Hey everyone, welcome back to CAPSA, where we simplify complex medical concepts. Today, we are diving into IV fluids, something every healthcare professional needs to understand. Whether you are a student studying or practicing, knowing how these fluids work is critical to providing safe and effective care. We will explore isotonic, hypotonic, and hypertonic solutions, including when to use them and what they do in the body. Let's get started. So, first up, isotonic solutions. These are the most common IV fluids used in the clinical practice. Isotonic fluids, like normal saline 0.9% NaCl and lactated ringers, have been the same osmotic pressure as your body's cells, which means the fluid does not cause cells to shrink or swell. They are great for treating patients who need fluid replacement due to dehydration or blood loss. D5W or 5% dextrose in water is also isotonic when it enters in the body. But as the sugar gets metabolized, it becomes hypotonic. Isotonic fluids are commonly used in surgery, trauma, and shock cases because they help restore fluid balance without causing any shift in or out of the cells. Okay. Now let's talk about hypotonic solutions. These have a lower concentration of solutes than inside the cells, which causes water to move into the cells, making them swell. A common example is 0.4% sodium chloride, also called half normal saline. Hypotonic solutions are used when you need to rehydrate the cells, such as in cases of diabetic ketoacidosis or hypernatremia. However, you have to be cautious when using them because they can cause cells to burst if overused, especially in patients with cerebral edema or head injuries. Finally, we have hypertonic solutions. These have a higher concentration of solutes compared to the intracellular fluids, which pulls water out of the cells, causing them to shrink. Examples include dextrose 10% in water or D5LR. Hypertonic solutions are often used when or as needed as volume expanders and in patients with severe hyponatremia where sodium levels in the blood is very much low or dangerously low. These fluids help pull water out of the cells, increasing in extracellular fluid volume. But again, be cautious. Overuse can lead to fluid overload and complications like pulmonary edema. And that's a wrap up of our breakdown of IV fluids. Quick recap: use isotonic solutions for general hydration, hypotonic solutions when you need to hydrate the cells, and hypertonic solutions when you need to pull fluid out of the cells. Understanding these concepts can really improve patient care and help you avoid complications. If you found this video helpful, please give it a thumbs up and don't forget to subscribe to CAPSA for more pharmacy and biomedical tutorials. Let me know in the comments what topics you want to see in the next. Thank you.